All right. Well, as Hira said, I actually have two studies we've crammed into one presentation today on uh, the physician perspectives on artificial intelligence and a separate study on their perspectives on wearable tech. I hope that folks can bring their own experience into the comments and the questions because really that's what makes these events special since you are all very much on the front lines of what it looks like in your own systems environments. All right. No conflicts of interest to disclose here. And as I said, we'll cover two chapters today. And it's always nice to start with some common vocabulary. I know this is a highly educated audience on a lot of things in healthcare and certainly in AI, but we'll start with some level setting. And this is actually, these data get released later on from Health and Human Services. But so this is the most recent data looking at 2024 spending in healthcare. And this will come as no surprise to so many of you, but approaching $5.3 trillion in healthcare spending across all of these different categories, hospital care being the largest chunk at 31%. And of course, at the same time, the growth in healthcare spending is outpacing gross domestic product growth. And we're talking about approximately 18% of GDP being dedicated toward healthcare spending. Probably no surprises to many of you here, but important just backdrop for our comments on AI. And at a little more micro level, what do physicians and other healthcare workers face on a day-to-day basis inside health systems? And these are all things AMA has been involved in measuring, advocating for, trying to remove barriers to practice. And it's things nowadays like lack of workplace autonomy and control. It's the time and productivity pressures that healthcare workers face. It's the aspects of administrative and quality reporting that can be sometimes burdensome. We all know about the prior authorization challenges that physicians and other professionals have to face in a healthcare environment to help do what's best for their patients. So again, I always think about the AI as a socio-technical uh, uh, thing, and this is the environment that we are trying to implement AI in. And I don't need to define AI for any of you here, but I think it's, we've begun including this agentic um, definition at the bottom here. And I think this is just an important evolution of how we think about AI today. So agentic systems are capable of operating more autonomously, making decisions, and taking actions not necessarily with direct human intervention, and can weave processes and steps together, planning actions, scenarios together in ways that are distinct from prior machine learning algorithms. And arguably, I think again for so many folks in this audience, you've been down this road for a long time, and we've gone through different evolutions and epochs of AI. And arguably, today's mode right now is in generative AI. And I think this becomes important in terms of physician sentiment because it's in so many parts of the rest of our lives, whether we're doctors or any other person out there in the environment. We're experiencing these things in many cases before they ever reach the healthcare environment. And that does make the use of these tools a little bit different in terms of how it plays out. And we also try to look ahead into the future a little bit on this implementation horizon, if you will. This stuff in the gray, largely things that health systems may already be deploying or using in different ways today. And this kind of frontier going beyond that looks at additional productivity enhancements, scientific developments, including in drug discovery, more sophisticated analysis of user generated or patient generated data and so on. So I think we continue to look at this and ask you all the question of what else should be on this map right now and what has already reached the point of wider adoption. Other level setting, there are something like, I think this is the latest data, at least as of earlier in August 2026, of around 1,500 or so devices that are FDA authorized that have some sort of AI or algorithmic element component to them. And you can see that radiology completely dominates at 76%, with cardiovascular oriented devices a distant second, but still sizable. And then it drops precipitously from there. So um, I want to at least mention that this is somewhat new in the past year that AMA has launched a new Center for Digital Health and AI that is intended to pull together a lot of what we know and want to see in the healthcare environment, including policy perspectives, what it means to integrate in clinical workflows, a lot of education resources, and ultimately collaboration, which I hope will be with some or many of you in your different settings as we get going. Uh, a lot of what we do, it starts with policy principles. I won't go through all of these, but suffice to say, this continues to evolve for the AMA. And when I say policy principles, this is largely built on the consensus of lots of physicians of all different specialties and geographic settings and practice settings. And you can see, how we're thinking about this now. It isn't just AI in the clinical environment. It's also things like patient privacy and safety. It's questions of liability. It's how payers and insurers may be using AI in decision making. So let's get into the survey data. And just to level set here, we had about 1,700 physicians. This was a survey collected earlier in 2026, and I fully recognize that, especially in a topic like this, the world keeps changing. But I think you'll see that directionally, because we are able to measure this now for a third wave, you'll see how it is directionally shaping up, knowing that 6 months or so have passed since this window, and I'm sure there are plenty of new discoveries. But we have a geographically spread audience with folks in different practice settings and different specialties, including 1/4 of them in primary care. So we first looked at use cases. So these are physicians that uh, we were asked them, what, if any, use cases are you incorporating in your practice today? And you can see the trend here. We started measuring this in 2023, but the latest data puts us at around 72% have incorporated one or more use cases in their practice. And that aspect of uncertainty about whether AI has even existed in their practice has decreased from 18% to 9%. So physicians seem to be not only using it, but more aware of its presence inside their practice setting. And this professional adoption seems to follow what it looks like in their personal lives. And this is interesting. So, again, as we said, what's different about generative AI? Well, it exists in so many different products and day-to-day things nowadays, whether it's a algorithm-enabled search on the web or apps or tools you may be using in your personal life. And here we see that physicians are reporting high personal use, 35% using it daily in some way, whether that is the likes of Chat GPT, perhaps Open Evidence, customer service chatbots, and so on. So they're familiar with it. And this trend spills over to the professional setting. Now, we asked about, well, what use cases are you actually using in your practice? And in purple is the latest numbers here. The number one dominant use case is summaries of medical research and standards of care. So think about the likes of UpToDate and Open Evidence and other tools like that. Discharge instructions, care plans, and progress notes being second. documentation of visit notes. I expect this number has probably increased as ambient scribing has really taken hold. But you can see, close to a third saying, yeah, we're using this for visit notes, medical charting, and so on. So this gives you a flavor for it, specifically what key use cases physicians are using, at least, somewhere in between uh, 17 and 39% of them. And physicians expect these use cases to continue to expand. And in the dark purple, these are physicians that are saying they already are using them. And the light purple is what they expect to be using more of within a year. And again, there's a lot of optimism one can interpret from these slides around getting up to date summaries of guidelines, medical research evidence, and standards of care. So uh, this suggests that there's a lot of optimism that there's some stickiness to some of these use cases for the future. But adoption is only part of the story. Um, we also looked at perception and sentiment around AI's impact. And we looked at whether physicians are seeing this currently as an advantage to patient care. And again, we have the benefit of looking at some trends over time. And this number has increased fairly steadily over the past three waves that we measured this. At the same time, nearly that's like close to 40% are more excited than concerned. But there's sort of in the next to that is something like 40% of them, a bit more than this, are equally excited and concerned. So there's some healthy caution among the physician community too. And this mixed view kind of breaks out a little bit more clearly in this data. And so here we're looking at a range of perception of harm versus help. And so on the toward the right are physicians responding that these aspects of factors inside their work life, are these tools going to be more helpful or harmful to them? And it's a bit rank ordered here. And so work efficiency, a lot of optimism that these tools will continue to help improve work efficiency, productivity, diagnostic ability, also significant increase there from the last time we measured this. Cognitive overload, also optimistic. But as you go down to the bottom here, what stands out? Well, physicians are genuinely concerned about patient privacy, their ability to have conversations in confidence with patients and know that that's between the patient and the doctor. They're also concerned right above that in the quality and the endurance of that patient physician relationship. So those things stick out um, in terms of how physicians see more harm being produced than good, particularly around patient privacy. Now, most respondents here expect AI to automate administrative and clinical tasks that contribute to burnout. Um, and most would say that the AI itself, as we saw before, should alleviate and should not worsen burnout. And so, of course, it depends. It plays out differently in terms of what work is being offloaded, replaced, or removed. Are these clinical tasks or are they administrative workloads there? And I think this might be some of the most interesting results and requires the most careful thought among this community within Health AI partnership. And that's the question of skill loss. And I'm reminded by physicians of different uh, positions in their career that there's skill loss if you are a practicing physician. There's concern around skill loss if you've been practicing for a number of years. There's also the aspect of skill acquisition and skill development that happens much earlier in your career journey and your training journey. And there's concern. What we found was that particularly those who are early career, less than 10 years of practice, had the largest amount of concern over loss of skills in themselves. So these are the youngest generation of physicians that are raising their hands, despite this notion that they may be the most technically savvy given their generation position. They're also expressing the most concern over that potential for loss of concerns or maybe the absence of development of the right skills. And you can see, depending on where you sit among the physician community, you may be a more senior physician looking at the next generation of medical students and residents. Perhaps they're rotating through your setting and wondering if this loss of skills is going to be a really serious concern. Now, we also wanted to look at what are the accelerants and barriers that are in the way to further incorporation of AI and what can enable it. And what we found was that, of course, physicians, much like their approach to therapeutics and interventions and other healthcare interventions, safety, efficacy, and the validation of those two dimensions are important, just as they would treat any other intervention. And privacy still comes out uh, there in that they can maintain that patient-physician relationship. But safety and efficacy, what you would normally attribute toward regulatory bodies and agencies, is very important to physicians in order to encourage more adoption. And I know this has been a frequent conversation among folks in this community too, which is what is the right liability framework that would increase trust in or adoption of AI? And physicians certainly want clear liability frameworks. They also want to be able to have models for post-market surveillance, including adverse event reporting, increased oversight of AI-enabled medical devices from bodies, regulatory bodies like the FDA, and so on. So liability frameworks are very important to doctors in order to increase adoption. And most physicians want to be consulted or directly involved in the implementation of AI. And this follows with our policy that we've long said that we want physicians and physicians themselves want to be involved in design, development, deployment, implementation, use of AI in their settings. They don't want to be uh, simply on the receiving end of these tools without having a say in it first. And we asked them what would be most helpful in evaluating or implementing tools using AI in our practice. And clinical evidence for the tool using AI is the number one item that would be most helpful. And we asked them, well, what type of evidence? Is it peer-reviewed literature? Is it clinical trials? Is it knowing that physicians were involved in the development of the product or the algorithm, et cetera? It's all three, but peer-reviewed literature stands out. 50% of those who wanted more clinical evidence says that has to come in the form of peer-reviewed literature. People want practical guides, implementation guides, and they want access to experts, something that I know HAIP does with this community in terms of technical know-how, and also ways to learn and keep up with this very fast-moving space. And while this is not part of the survey data, it's important to continue noting that ethics deeply matter, right, in the implementation of AI in our practice settings. And again, there's been a lot of smart folks that have looked at when things have gone wrong in this space. But I would say we offered these two sort of very high level questions from some of our ethics experts, just simply first making sure we understand what is the intended use of that tool in practice, and what do we know about how the AI tool is designed to either maximize benefit and minimize harm. So these are basic thresholds that need to be met, and We have some additional framework resources here. I'll show them in a second. But again, that question of evidence, how does it affect the current standard of care and my relationship with my patients? What is the most ethical use of this tool? And what situations or scenarios might I encounter that would generate questions of ethics? Transparency, equity, and accountability, especially on the right-hand side here. What if I disagree with the tool's findings? Not only are there liability questions there, but an important moment around autonomy and agency for physicians practicing medicine. Does what they believe to be right overrule what the tool or algorithm may say? And this actually was just announced yesterday, so it's hot off the press, and I'm really proud to highlight that we have some ongoing enduring CME materials on the ethical use of AI in medicine. And these were produced in partnership with Duke Institute for Health Innovation, DHI, and folks in the Health AI Partnership. So these are live out on our EdHub and freely available for learning and CME credit. And encourage you all to either reach out or go discover them yourselves. So I'm going to switch gears into chapter two here, which is uh, the wearable data. So bear with me here. Obviously, there's some overlap between the world of wearables and the world of clinical algorithms and AI, and we'll hopefully be able to explore that in the Q&A a bit too. Unlike the AI study, which was United States based, this one was actually a multi-country study of 6 different countries, including the United States, the UK, Canada, France, Germany, and Spain. And our core questions was really about what does it take for the wearable data to become routine in physician use? And so why did we do this? Well, we know today that we've got hundreds of millions of users out there that are generating physiologic data on their smartwatches, their rings, other biosensors. Um, we know, especially from the survey, that this data is reaching physicians, regardless of whether we have systems of record and interoperability and validation in place. We know that clinical integration is dependent on reimbursement structures, appropriate regulation, and workflows. And so we were motivated to try to better understand, uh, what those barriers were today and what we could do about them. And this survey was done in conjunction with Medscape across these 6 countries. The survey instrument was translated into local languages and so on. Around 2,200 physicians were surveyed again earlier this year. And we did specifically define a consumer digital wearable. This is a wearable that is not prescribed by a doctor or another clinician. These are the wearables that you go to Best Buy or Costco or wherever you might go, and you're purchasing them. It's patient initiated, not provider described. And you can see all the familiar examples you might think of here in this space. And that the headline, kind of the big takeaway is physicians across these 6 countries have very similar exposure and high exposure to wearable data and an interest in using it. And it's really the specifics around the workflows, the payment mechanisms, differences in evidence standards, and the support systems in the health systems as to whether integration can take hold or not. And again, this just shows it's really a tight range here, from 85 to 90% from France to the UK in that range uh, of physicians saying they're reviewing at least one type of wearable data. And what are the types? Well, it's things you can already imagine: heart physiology, different activity and function, events and alerts like falls or AFib, and sleep patterns. So they're already reviewing the data. And I think, especially if there's physicians on the line today too, I think this probably won't be surprising to many of you too, that cardiology is the number one specialty looking at wearable data. Endocrinology is a second there in the purple there. So this is used weekly. The purple is used in weekly clinical actions and activities. And who's most likely to integrate in the next 12 months is in the blue line there. So high for cardiology and endocrinology relative to other spaces. And at the country level, Spain and Germany actually were the lead on the likelihood to integrate. Um, Around 40% for Spain, 38% uh, for Germany, uh, most likely to integrate wearable data in their practice settings. The US itself, if you look at the yellow line, that's who's currently integrated now. The US shows the highest amount of integration um, in its current state right now, but a little less momentum for what might play out in terms of the sentiment of physicians in the next 12 months. And some of this is explainable, particularly on the certainly on the country level and at the specialty level. So it will come as no surprise that the U.S. completely dominates in investment, particularly at the venture capital level, compared to other countries. It's kind of an order of magnitude difference between the next country, the UK, and the United States. The number of companies, there are many, many of these out there, with some more dominant than the others, including the big tech firms who all play in this space. And again, with this 4.7 billion in funding over multiple years, it does play out. 1.3 billion of that is focused on cardiology in the U.S. Neurology as another component there. Endocrinology and diabetes, 108 a million. So sizable investments in each of these different specialties, but cardiology really sticks out here. Now, I think this is encouraging, which is when patients are taking the initiative and they're showing up to their doctor's practices and saying, I've got some data I want you to look at. Physicians are responding positively, and physicians are taking action in all of these country settings. Um, and still, though, there is, as you can see here, a range between something like 29% and 42% of patients that are actually asking uh, for an analysis or a comment on their wearable data. So not as much saturation as is needed perhaps there. And we also asked about how much regulatory trust matters and is influential for reviewing the wearable data. And again, this is a fairly tight range. And we asked about specific entities in different country settings, and where we knew they existed. And it is something, of course, important. It's something our own organization advocates for, having appropriate regulatory bodies that are weighing in on the validation, clinical validation of these uh, the the hardware itself and the measures. And so what came out in the data was these four gaps that I think are opportunities both for health systems and for companies out there trying to increase utilization of wearable data in clinical practice. Physicians want RCTs or clinical trials as the number one evidence source. They want workflows to be functional. That includes integration. In EHRs, physicians don't want to see a PDF or a separate output from a wearable that they have to look at separately and cannot be integrated into an EHR. Um, it's suffice to say we do not have adequate or existing payment and reimbursement pathways for consumer wearables. They may and do exist for other types of wearables like glucose monitors, but not for consumer wearables. And there may be good reasons for that today. Um, and whoops, and the liability gap is something we can draw a line from this back to the artificial intelligence survey data is that medical and legal concerns is first of all the top ranked workflow concern in the US and also the highest rated concern in France. This is a shared concern among physicians about who's responsible for liability and either how the data is used, how it's incorporated, whether it's ignored or incorporated in clinical decision making. So, still a gray area for many care settings today. And you see this play out at the country level too. Again, those medical legal concerns, France being number one for the US, it's and several of the countries, it's one of the highest concerns. Accuracy of medical device of these wearables is important, as are evidence for actual outcomes in uh, aspects of patient care. So, if we take a step back, what are we taking away so far from these survey insights? Well, we think that physician exposure and interest, just like it is in AI, is high, and it's largely a solved problem. There's not questions of whether physicians know or are aware of how wearable data could be used in practice. But we do have to close that confidence gap in terms of the evidence, the RCTs, the liability issues, and so on. They do want to know about real world performance. They want algorithmic transparency in terms of the claims that are being made by these companies right now. I won't name the company, but this was just in the news even a couple, 2 or 3 days ago around the reliability of sleep measurements from one particular wearable manufacturer. So it's playing out in real time now. And like a lot of things in healthcare, the structural conditions at which we all um, operate and deliver healthcare in matter greatly. Less so the physician willingness to do something new in their practice and different. So I know I went through a lot there from two different distinct surveys. The complete results, I didn't share all the results because they are in a larger documents that are available on AMA's websites, and I'm happy to send those out or direct you to them if you just message me. With that, I think we have at least some time for discussion and questions. And Sierra, I'll hand it back to you for now.
We do. I will go ahead and open us up for questions. Feel free to place questions in the chat, or go ahead and raise your hand and I will call on you to unmute and ask. I'll get started with some of the questions that we had submitted through the registration form. So, first, can you speak to what it would take for consumer wearable data to be considered sufficiently reliable and clinically valid for routine clinical use?
Sure. And I'm putting aside, the survey data and putting on, our AMA hat and what we would like to see in the environment. And I think of like four layers of validation, if you will, or four types of validation to get there. One is at the device level and understanding that the device, we're talking about sensor technology itself. We know from past history that sensor technology is imperfect and actually can be biased around things like skin color and other factors. So having validated devices is important. We kind of modeled out that point, particularly with blood pressure cuffs and blood pressure measurement devices. Not all devices are made the same, even for a measure as routine as blood pressure. So the device layer is one aspect, the data layer, and uh, we can trust things like heart rate pretty well. Step count is pretty reliable unless have a different way of walking. Um, but things like energy expenditure, you see with some of these wearables, they are aggregating different signals into a sometimes a proprietary metric where we don't know enough about whether the way that data is measured and calculated is appropriate, and where algorithms are being applied to that data. Um, the 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 use layer in terms of what are the scenarios where you're using this wearable data? Think about a range between trying to understand patterns and trends in your, activity and lifestyle and well-being versus and getting coaching and advice and guidance and tips on how to get better at that versus diagnostic and treatment decisions, which is a different level of validation that's required before you can use this data and offer that. But arguably, we'd say that at least patient generated data from wearables can give you some longitudinal sense and pattern if used long enough around what the patient's, some of these activity indicators that could be useful. And then, like on the population side, how do we use this for, at a population level? Well, we certainly need ways to understand bias and wearable data measurement, not only accuracy but bias. We need the standard things around interoperability to make sure that um, if you're getting, a step count from one device, that it could be similarly reliable to a step count from another device. And until we get there, there's a lot of device questions around the variability from one device to the next that makes it hard to achieve a consistency. Uh, I see some other stuff coming in, but Sierra, was there a follow-up to that or another question?
Some requests for links. I
Okay.
do see that Senna just put a question in the chat. She said for wearables, what is the biggest gap between physicians seeing value in the data and actually incorporating it into clinical care? I don't know if there's a right or wrong answer, but curious to see what your perspective is on that.
Well, I think it's some of the things that I just touched on. So this notion of clinical validation, I think, is what physicians will continue coming back to, and again that plays out from software algorithms to the hardware itself, and aspects that are proprietary. I think there's a big push among wearable manufacturers to find new ways to uh, uh, back their way into blood pressure measurements, right, or proxies for blood pressure without a cuff around the arm. And so those are examples of where, you know, perhaps it will be solved technologically in the future, but we don't know um, exactly, what the best approach is there yet, and whether that's, legitimate to upend a gold standard like blood pressure done correctly. So yeah, I would go back to what physicians refer to as clinical validation.
Thank you. A similar, I guess, or analogous question. The physician sentiment report has shown that AI use among physicians has grown dramatically, but 40% or so still describes themselves as being both like equally excited and concerned. So what do you think is kind of holding trust back, and what can we do to improve that trust?
Yeah, this is a fun question, and I think I'll share some thoughts and opinions. And again, going back to my disclosure at the beginning, not necessarily, the summarized thoughts of my organization. I think we're in a very, unique and fragile moment where AI is, even yesterday's folks might have seen the headline around Bill Gates kind of sounding the alarm around what AI will do writ large to this notion of a workforce and employment, right, among other things. So we can't separate out the zeitgeist of AI technologies being almost ubiquitous now in different facets of our life. But questions coming up around uh, the appropriate use of algorithms. And even again, it's a stretch here, but there was a Facebook legal settlement, right? That's kind of monumental around essentially algorithms and social media, a little bit different, but I think those concerns are, there are diffusing across all these different technology spaces. And I think it also when I showed that slide of all the pressures physicians are facing, there's some macro things like consolidation in medicine, corporate practice of medicine, the role of, you know, uh, things like private equity that are all playing out in real time now amidst these technology deployments. So depending on what practice setting you're in as a doctor, you may be doing this in a very sort of constructive, collaborative way with other, technology leaders in your healthcare organization, or this may be being done to you. And I think depending on what setting you're in, you're gonna, you know, be, on that spectrum of optimistic versus skeptical. But I'd love to, I don't know if folks have other thoughts they want to put in the chat there too, because I think it's a great question and what they might be experiencing in their setting.
Yeah, folks, feel free to chime in or to come off mute and share opinions or thoughts as well. Okay, next question. Alifia, do you want to ask yours?
Yeah, thanks, Chris. This was awesome. I had a question around like the wearable data and whether like AMA or do you know if any other organizations that are tracking like integration of that data with electronic health record or medical data itself, or are there any successful models you've seen, or if AMA has an opinion on that? Because I think that could provide a lot of value, as mentioned through the survey around like clinical care, but also as around like research and innovations as well. Yeah.
Yeah. Well, I don't think we're tracking the kind of the use cases of where it's a great opportunity, I think, for someone to measure those use cases for wearable data. I know there are efforts around, algorithm implementation in health systems and trying to understand that inventory of use cases and where it's happening. For wearables, I mean, for example, I was pretty fascinated by uh, it's not quite wearables, but Germany has this group called DIGA. I don't can't say the German part of that acronym, but essentially, has a curated list of apps that are sometimes paired with devices that are um, immediately prescribable by the doctor if it's appropriate for that patient, and they have mechanisms to be able to prescribe and also, train and get that patient up to speed on how to use those devices and have the system be reimbursed there, or the company be reimbursed in this case. And so this is, I think, labor intensive, but they have a heuristic for how they evaluate when these solutions can go into, day-to-day use in practice and prescription, right, to the point of prescription.
Fantastic, thank you. I'm seeing a question from the Tom in the chat who wanted to come off mute but is currently
Oh,
in transit. He was just speaking to their physician advisory group about AI and its implications on medical liability and current legislation. And he wanted to ask, as this tech takes on more clinical decision support functions, where do you see physician accountability beginning and ending? And should that boundary shift as AI becomes more autonomous?
good. Yeah, good question. I think where we would start was understanding this spectrum of risk, so risk-based regulation rather. There are low risk wearable tools, again, like step count. There are higher risk tools that require more scrutiny, and guardrails. Um, in terms of, this notion of accountability, we would say that developers certainly should be accountable for their tool, their device, and this applies to kind of wearables and AI models too. Their tools performance, like claims around their performance. Um, Physicians, there's question marks around should physicians be accountable for, essentially negligence when they choose not to use them, uh, but should be used. I think those are scenarios we haven't quite faced yet, but will likely face. But I think we would land on the side of the manufacturers themselves need to take ownership of liability for claims of performance, right? Of and efficacy or effectiveness of those tools.
And I think that already partially answers one of the follow-up questions we had. You talked a little bit about kind of developer liability and responsibility, but Alice asked, do you see accountability frameworks being distributed? And if so, like across what parties?
Yeah, I mean, I think it starts with the developer and manufacturer, I think needing to take that responsibility. Um, but I think we have a lot to learn because again, these are tools that are deployed in imperfect settings, right? And so if you talk about algorithmic bias, we don't, I think, necessarily have a great way yet, unless it's really carefully studied by folks on this call, how to attribute where that bias plays out, right? Is it in the algorithm itself, or is it in the system in the setting where that bias may have already existed beforehand? But part of this also gets, what do you do pragmatically and practically? Well, we likely need more robust systems around monitoring, like what you might call post-market surveillance. I think I had one statistic that the FDA has already recalled um, a handful of devices that are doing, radiological imaging applications of some sort. So we do have at least a um, a sense that this can be done if there's something that may be wrong in the environment, that there needs to be mechanisms to do something about that quickly. And it would seem that that's part of the role of these regulatory agencies.
Thank you. And I think we have time for one or two more questions. So if you have any last questions, feel free to put those in the chat. I'm also seeing one more question from Tink. He asked, he's curious about your thoughts or recommendations to physicians about how to communicate with patients who bring kind of the AI conversation or wearable data into the clinical encounter. How should physicians be kind of handling patient use of AI?
Yeah, good question. So I didn't share those results, but we did ask around at the time. We said, do you think your patients are using it, coming into practice or coming into the clinical encounter, ahead of time? And most physicians, I think, recognize that, yeah, that's absolutely happening. I think there's a really could probably find it at some point, Kaiser Family Foundation study or Kaiser study on uh, patient use of AI and chat engine LLMs for either medical information or medical advice. Like, how are they doing that, right? And that gives us a sense that yes, it's absolutely happening. Uh, we've had a lot of internal discussion about this in particular, and I don't. I think we want to recognize that patients will continue to seek, help wherever they can get it, especially in a health system where access is a real challenge, right? And so I don't think we should at this point be surprised that patients will be turning to anything that's available to them um, to either, learn more about a, condition or symptoms they might be having. Um, but I think, part of the physician role is to help educate patients on the like appropriate use of those tools. And I think, other uh, actors in this system, particularly, the companies that are providing these services, can give appropriate guidelines and stuff too around these things not constituting medical advice. It seems this is playing out though, again, in real time around some of these services. I think there's a Utah example out there that others can probably speak to better around, where this might go to, cross into new territory and, um, put patients' lives more at risk.
Fantastic, thank you. And I think that leads really well into maybe my last question, um, which is, the physician sentiment report showed that physicians have, some concern around skill loss from AI. And as these tools get increasingly introduced, how should health systems think about kind of workforce training and maintaining clinical expertise as AI plays a larger role?
Hmm. Well, I again, like I go back to the fact that there technology is rarely just, a nice technology in a nice box that back in the day you used to put the CD-ROM in the drive and install the software from the CD and you're off and running. Um, I think uh, there's still a lot to learn around if and how or why these technologies are different in the cognitive aspect of practicing medicine. And again, there are some really smart essays and op-eds out exactly on this topic that I'm continuing to learn from and just try to see different perspectives. But I think that gets at the heart of the matter. Like, the healthcare environment has adopted technology for forever, like literally forever, like thousands of years, but also in the past 100 years, physicians at one point, in health systems were skeptical of putting phones and even fax machines in practice, and they did it, or computers, right? We've seen all of these periods. So we have to ask ourselves, what is different now compared to previous technological innovations in healthcare? And the biggest thing may be, are you shifting that cognitive load? How much of it are you shifting toward a machine or an algorithm? And does that free you up to do something more cognitively complex and more important? Or does it, sort of relegate you toward a very limited purview and ultimately impact what you can do for that patient? Um, and so I don't have any perfect answer there. It seems like one of the most important questions. And again, this notion of de-skilling but also no skilling, right? Like, and so the great example I heard and talked about recently was the ambient scribes, which most are, undoubtedly most physicians love for what it can do around their own well-being and productivity in pajama time, what they're doing at night to write up their clinical notes. But someone made the point that what about those residents and medical students who may be doing it for the first time, those residents, and they're in an ambient scribe environment and they're not going through that pain of having to recount what they experienced earlier in the day and going through that deeper thought process about what might be an issue with this patient. What happens when that's already just captured and they don't go through that thought process? That actually kind of kept me up at night. Just as an example of like, hey, great productivity gain for the first time in healthcare. We actually have productivity gains, but what are the unintended consequences? And it's not necessarily like, okay, you need to change the software product around. It may be that we need to just re-examine how we're doing training and what is permissible in those practice environments for people that are still developing those skills. So I again love to have learn from all of you on that topic too, because I think it gets at the heart of things.
Well, thank you so much, Chris. We really appreciate you being here with us today. I will be sure to kind of link those studies that the AMA has completed in the posting of this recording. If you all have any other questions, please feel free to email Healthy Eye Partnership at the email on the screen. And if you have a few moments, we would love if you would participate in our survey that just launched. We always are looking for input from the community on what topics you are interested in hearing more about. So thank you again for joining us. I will leave the call open for a few minutes for those of you who are able to complete the poll. And we hope to see you again at a future event.